Are you conducting research with young people from regional, rural, and remote communities? Research that impacts metropolitan populations is not always relevant to those from regional, rural, and remote communities. So it is important to consider the challenges for young people that live in these geographic areas. There are many benefits associated with living in regional, rural, and remote areas of Australia, including a slower pace of life, opportunities to connect with nature and community, and strong connections with family, friends, culture, and community. However, young people living in rural and remote areas experience varying challenges such as feeling of loneliness, isolation, and sometimes boredom, inequalities in education, employment, and access to the internet, and minimal support to assist with mental health and substance issues. Additionally, there are barriers to accessing services such as high costs, limited transport options, and fear of privacy in small towns. These challenges contribute to poor mental health in these communities. In fact, according to Mission Australia, 1 in 4 rural 15 to 19-year-olds has a probable serious mental illness. Young people in these communities have also been impacted by significant events in recent years, including drought, natural disasters, and a global pandemic. So, how can we better involve young people from regional, rural, and remote areas in research? Our Youth Advisory Board is calling on mental health and substance research to conduct new research to understand the unique challenges that young people in these communities face, the impacts of rural isolation on mental health and substances, and how to improve support services and their availability in these areas. A good place to start is to identify and connect with research institutes and youth-based organisations that are already working with these populations. It is also important to consider the specific needs of young people in regional, rural, and remote communities. To do this, you may need to tailor interventions specifically to the communities of interest and test the interventions with these communities. Include young people from these communities at every stage of your research, and consider and address barriers preventing participation in research, for example, factors such as transport, internet access, and privacy. Let's work together to ensure research is inclusive of young Australians in regional, rural, and remote communities. To learn more, visit the Matilda Centre website.